Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for dysentery. What is dysentery? When repeated evacuations from intestines occur due to microbial infection, microbial means either bacteria or parasites, in the way of liquid stool with mucus and or blood with other troubles, it is called dysentery. Dysentery are of two types, bacterial and amoebic. Generally, it does not stay over 3 to 7 days, but in certain cases, it may turn into a severe form owing to extreme dehydration causing even death. What are the reasons of dysentery? Number one, bacterial. Maybe bacteria, maybe Shigella. This is Shigella. Microscopic photograph of Shigella bacteria. Salmonella, the same thing. E. coli. E. coli, I have not seen any paragraph, any image actually. Number two, amoebic or amoebic, that is parasitical. That is Entamoeba histolytica. This is parasitic. Entamoeba histolytica. Image. Number three, due to taking of food owing to erroneous habits of drinking water, dysentery sometimes lingers on. Many a person suffers from chronic dysentery due to this error. This I will discuss later on. What are other symptoms of dysentery? Number one, pain or griping pain in abdomen, about navel. Number two, fever. Number three, nausea, vomiting. Number four, tenesmus at anus, maybe also in the rectum. Weakness, dehydration. When to see a doctor? For babies, if disease is not contained in 1 day or for others in 3 days. Number two, when dehydration is manifested, repeated thirst, eyes, face look sunken, urine diminished, color becomes intense, skin, lips, tongue appear dry, drowsiness, no response to call, headache, etc. These are actually symptoms of severe problem in the subjects. Number three, fever over 103 degree Fahrenheit. Number four, passing of much blood with stool. What are possible complications of dysentery? For bacterial infection, number one, arthritis following infection. Number two, infection to blood as seen in patients with weak immune system, as in AIDS or cancer subjects. Number three, hemolytic uremic syndrome is a severe kidney disease, complex kidney disease. Seizure, picture of seizure on this shown on the right hand side. Seizure actually sometimes have convulsions or spasms. For amoebic infection often spread to liver, lung, brain. This is a very serious type of problem. You see this picture. The amoeba that parasitic has penetrated into the tissue of liver or has come in the tissue of the lung or it has moved to brain. These are amoebic, I mean the Entamoeba histolytica cells are in the brain matter. These are very, very severe complications. It often happen in case of severe amoebic dysentery, and with some trouble of patient also, some problem must be there, otherwise it won't happen. It will not happen generally. It's a very serious disease. What foods should be taken during dysentery? Applesauce, warm rice or oatmeal, banana, toast, etc. Called bland foods that do not arise unfavorable symptoms. Other foods like apple juice, chicken or fish soup, water of green coconuts, glucose saline water, etc. are partial recovery. After partial recovery, no oil, egg poaches, omelets, spiceless boiled veggies, etc. That is, to start with these things up to this glucose, up to this glucose saline water. Then after partial recovery, these things: no oil egg poach, omelets, no oil of omelets, spiceless boiled veggies. What food should not be taken during dysentery? Milk or milk product, fried or fatty foods, spicy food, corns, pineapples, coffee, tea, alcohol, artificial sweeteners. How to prevent dysentery? Number one, washing hands before food is a must. Use or spoon or cutlets washed with hot water. Take fully boiled foods. The drinking water must be free from all contamination. If not available, take cooled boiled water. During taking of food, drink as less as water as possible. I have already mentioned that I will discuss this. What should be the healthy practice of taking water during food. This is being described here. During taking food, drink as less water as possible. One may get enough water before taking food. Just after finishing food, don't drink much water. Enough water may be taken after 30 to 40 minutes of foods. That is, to start with, you can take any amount of air. It will not in your stomach. It will pass out soon. Then you take food. While taking food, try to take water as less as possible. After completion of taking food, you wait for at least 30-40 minutes. Then you take as much water as possible. In that case, the water will not disturb the digestion, and the dysentery problem will be less and less. Otherwise, the problem of dysentery will be continued due to erroneous practice of water taking. Number 4, if possible, take freshly prepared warm food. Stale cold foods tend to create dysentery. This is a very common thing. Aloe for dysentery. Fainting at stool or after. Frequent stool of bloody water. Bloody jelly-like mucus. Involuntary while passing flatus. Much aversion to fresh air, which notwithstanding gives better feeling. Hunger during stool. Cutting, pinching, pain in rectum, loin. Heaviness, weariness and numbness in thighs. During urination, urging to stool. Constant headache with frequent nausea. Sickness of stomach and great prostration. Dryness of mouth, great thirst. Aconite for dysentery. Fear and restlessness. Dysentery when nights are cold and days are hot. A little loose frequent stool with tenesmus. A little loose frequency with tenesmus. To start with small brown painful. At last bloody pure blood passes without feces. Rheumatic pains in head, nape of the neck, shoulders. Violent chill, heat and unquenchable thirst. Calamure for dysentery. Stool consists of only a small amount of blood or much blood pass with slimy stool. Sometimes thick white mucus passes as stool, grey or white coating at the base of the tongue. Magnesia carb for dysentery. Before stool, cutting and pinching in abdomen. During stool, urging and tenesmus. After stool, tenesmus and burning at anus. Desire for fruit and acid drinks. Milk causes pain in stomach. This is the characteristic term of calamure. Calibicromic from dysentery. Subjects driven out of bed in morning with urgent pressure of stool, which may be blackish, watery, bloody, jelly-like, stringy. Tenesmus during and after stool, with much debility and desire to lie down. Tongue dry, red, smooth or cracked. Much thirst, vomiting of bitter, sour, glary fluid, periodical return of dysentery in spring or early part of summer. Mercurius score for dysentery. Severe pain in the rectum, continue after stool with pressing downward in front of abdomen, below navel. Faintness, weakness, shuddering, limbs feel bruised and trembling. Face, hands cold with small feeble pulse. Burning and tenesmus conjointly of rectum and bladder. Mind it, tenesmus, I think in my personal opinion, tenesmus is the most severe in case of mercurial score compared to all other medicines. Suppression of secretions or retention of urine. Worse after midnight, in fall of hot days and cold nights. Podophyllum for dysentery. Great thirst but no appetite. Stools yellow, green, brownish, watery. Mucus streaked with blood, with heat in rectum. Flashes of heat running up back painful tenesmus. Descent of rectum with sensation of weakness in rectum. Sulfur for dysentery. When stool contain only frank blood, subject muttered delirium. Abdomen distended or stool are extremely fetid. Tongue as dry as wood. Anus prolapses. Much tenesmus after stool. Colossuntis for dysentery. Dysenteric stool works after least drink or food with griping pain, commencing at navel and pressing down to rectum. Stool passed with great straining and burning at anus. Burning along urethra during stool. Chill proceeding from abdomen. All troubles temporarily ceasing after stool. And warmth in bed, but temporarily, mind it. Weakness, paleness, prostration after stool, colicky, cutting and squeezing pain better by bending forward. Mercurius for dysentery. Cutting stitches in lower abdomen from right to left, worse by walking. Pains before stool and during stool with violent tenesmus. Rather increased after stool, that is tenesmus increased after stool. Hot sweat on forehead during stool, which soon becomes cold and sticky. That is to start with, the forehead was full with hot sweat, which soon becomes cold and sticky. Frequent discharge of pure blood, bloody green mucus like starred eggs. Children scream during stool. Fecal putrid smell in mouth. Nausea, vertigo, obscured vision and flashes of heat in bed. Worst during night till about 3 am. Mind it, mercurius sol and mercurius core both are important for dysentery, but there are